Good morning or afternoon, depending on where you're joining us from. I'm Simone Parker with our Stakeholder Relations team, and it's our privilege today to host the event and introduce your representative to the CalPERS board, Yvonne Walker. Before I do that, I'd like to explain the format of this meeting. It's simple. Yvonne will provide some updates on CalPERS, and following her remarks, she'll take questions as time permits. If you have a question when it comes time, you can raise your virtual hand and we'll call on you. You can access this feature by clicking the raise hand icon in the toolbar at the bottom of your screen. Once we call on you, you can click the microphone to unmute. If you need accommodations because you're unable to raise your virtual hand to ask a question, please send a message in the Q&A to one of our moderators so they can assist. If you need closed captioning, you can click the More button on the toolbar to access that feature. This webinar is being recorded and will be posted on our YouTube page next week. If you want to automatically be notified the video has been uploaded, you can always subscribe to the CalPERS YouTube channel. We have an hour today, so let's use our time wisely. With that, I'm pleased to introduce Yvonne Walker. She's serving her first term on our board. Yvonne served California and our nation for more than 35 years, working as a union president, retirement security advocate, experienced pension fiduciary, state worker, and Marine Corps veteran. She's known for being one of California's foremost leaders in fighting for the pension and health benefits earned by our members and retirees. It's a pleasure to introduce Ms. Yvonne Walker.
Thanks, Simone, and thank you all for getting on. Just a sec, because I turned on my captioning and it is very distracting, so I got to turn it off. All right. So thank you all for getting on. I really appreciate this. I'm going to dive right in. I hope everybody's doing well and keeping themselves safe from the weather. We're just coming off our board off-site this week. It ended on Wednesday, and we had I think, some really good educational sessions. We had Lionel Johnson from PPI. He's the CEO of PEI. And he had a geopolitical discussion, which I found extremely valuable. There was also Robin Grew, the CEO of Man Group. And if you're looking it up, it's MAN, Man Group. And hers was AI from the asset manager's perspective. And then also we had Eric Schneider. He's a doctor from the Harvard School of Public Health. And again, talking about AI as it relates to how its uses and how it relates to public health and what's going on. Because we've heard a lot of things, right? That, like, oh, everything's going to be AI. We're not going to talk to people anymore. Dr. Schneider, I thought, gave a very good presentation. He said, it's not going to make it that we're talking to less people. It's going to make, if it's managed right, let me just say, it's going to make it easier for our healthcare providers to really focus on us. But he said something, I don't remember the exact term, but in my head, I translate it to WYSIWYG. So, no, not WYSIWYG, garbage in, garbage out. So basically, when you're doing with the chat PT and all that, you have to be thoughtful about, what you're putting in because, and then you have to check it. It's not enough just to put it in, get a response and relay that. You have to check it and make sure it's the right response. So I thought, I think we're going down, a responsible path. So I'm pleased to report that the preliminary figures that reported to the board, we exceeded our 6.8% target, and the preliminary figures are 14.8% for the 1-year return, woohoo, and 8.57 for the 10-year return and 6.81 for the 20-year return. And we report, we report all the different time periods. One, because they're a realistic sign of the pension fund's ability to pay benefits decades into the future. And it's just, and another indicator of the fund's health is a discount rate. It refers to the money it will take to pay long-term benefits based on life expectancy of future retirees and other economic factors. And this year, our funded status is 85%. And that's a 6% increase over last year. And, 68%, it was 68% 10 years ago. So we are on the right trajectory. I really appreciate that. And I just say all that and continue to say all that is, because it is, it's a lot of decisions, some difficult, but and steady discipline. I say it all the time. We're a long-term investor. We can't, focus on whatever flash in the pan is going on because our bottom line is making sure that our retirements, are secure. They're going to be there. And I got a call from somebody that said, "Did you tell people that there could be a time where we would not pay pension benefits on the last call?" And I said, "I don't think I said that. I don't think I would ever say that. But if somebody heard that, I didn't say that. I said I think what I said was it would be extremely unlikely. I never say never to anything, but it would be extremely unlikely, and we'd have to go through years and years and years and years and years and years and years of bad returns, and I just can't see that happening. So, in case there was any confusion." Um, the other thing that we worked on and we approved the healthcare premiums. And oops, Lord, let me tell you, I am happy to report we don't have a 10% increase. We don't have a 30% increase. For this year, we are down. Yay. I think it's the average increase is about 4.9%, which is whoo-hoo. That was like a relief because, I've been, I don't know about you guys, but I've been over the last few years dreading having to report out the numbers, especially, when they're high. But our healthcare team has done an incredible job making sure that to keep the increases down. And then there's one thing though. So United Healthcare for the basic plan, it doesn't impact most of us here on this call. It will impact you if you are a hybrid plan where you're retired, but your spouse might not be, right? Yes, then it'll have some impact. But for the people that are, straight retirees and you're on the same plan, we will still be, if you have United Healthcare Advantage, that will stay. You'll still be on United Healthcare Advantage. But for the basic members, we chose not to offer the United Healthcare Basic Plan. They wanted an increase of 30+%. They could not justify the reason for that. And our team went over all the numbers and we were going back and forth and, they didn't want to budge. And so they made the recommendations to the board. They made the recommendation to the board that we should not offer that. But then here's what they did. They went and they pulled and looked at one for everybody, for all the basic members that were in United Healthcare Basic. They looked at, where the main numbers are. It's not going to surprise you, it's in Sacramento, but they even looked statewide. And so to make sure that there was a comparable plan for folks that when it was no longer at it. But here's the thing. For the first time, well, I don't know if it's the first time, it's the first time since I've been on the board that we're contracting directly with the provider, with Sutter, because Sutter was the main group that our members from UHC were going to. And so we contracted with them. It covers 6 counties. It's going to be on the website, right? And in your open enrollment paperwork. And you guys are not. Mostly, it won't affect you. But if you have your kids or whatever that might still be working for the state, tell them to look closely because I think it's a game changer to contract directly with Sutter. And so we'll see how that goes. I think it's going to be amazing. We also, we made some changes to the health plan. So Kaiser Permanente is going into Northwestern Nevada. And so again, that's going to be by zip code. And at the board, I made sure to ask, are we going to make sure to send out to our folks so that they'll know, right? Because we're coming up on open enrollment. So, yes, we will. But again, please, when we're in open enrollment, please go and check and look. This expansion, I think, is a significant success story because we are continuing to move and try to provide greater access to care in the regions where they live. And I would just say, I mean, this stuff is, I'm excited by it, but it's slow, right? It doesn't just happen overnight. We don't say, oh, we want this, and then it happens. It doesn't. It takes a lot of work, a lot of conversations, but our healthcare team, I think they're top notch, and they are committed to providing equitable health care for all of us. And then also, and again, it might not be as important to people on this call, but we have added a family planning benefit. Now, if you're on the call and you want to plan a family anyway, that's great. No judgment here. Go ahead. Now you have that benefit that you could do it. Why you would want to, I don't know, but there you are. And then, again, we have the doula and everything else. I just have been really, really impressed with our healthcare team, not only with the things that they provide us, but with the way they are forward looking and forward thinking and looking for innovative ways to improve healthcare in California. And the saying, as it goes in California, there goes the world. And so I think that we're going to see a lot of good things come up in the next few years. Already, we have been innovated in some of the approaches that we have taken to rates and plans and everything else that people are copying what we're doing. So that I think is a good thing. Before I get off the healthcare, once again, CalHR is going to do their retiree benefits webinar, but they're also going to do one in person. So it is going to be on the in-person one is going to be on September 17th. And that coincides with the CalPERS meeting. So if you're coming in town for the CalPERS meeting, you might want to stay an extra day. You can go in person. They're going to have a forum. They're going to be able to, all of the plans are going to, give a presentation. You'll be able to ask questions. You can send in questions ahead of time. And then on the 16th, it's going to be a webinar. So if you're unable to get there, don't mind, because they're going to do a webinar. And so I would encourage you to get to do one or the other. I mean, last year was the first one, and I did attend, and I thought I knew something, but apparently I didn't, because it had a lot more information than I knew. And I really appreciate the fact that CalHR did this. And I don't know if I said this, but the in-person meeting is going to be at CalHR, and that is 1810 16th Street. And I know they sent it out. I know they sent letters out to the different stakeholder groups, but I am going to ask CalPERS, can we provide a link, in case you're looking. But even if we don't, you can always go on the CalHR website to get signed up, to submit questions, and everything else. Whew, that was a lot. I feel like I've been talking for forever. So I'm going to open it up to you. I hope you have some good questions. And I got about 40 questions. Some of them were like a little complex, and I wanted you to have better answers than just the short little blurb that I can do on this webinar. And so we'll be following up when we do the FAQs after the webinar. We send it out to everybody who's been on or sent something in, so that they can get a fuller answer than I can provide right now.
Thanks, Yvonne. All right, we'll start with Sonia. If you'd like to click the button to come off mute, you can ask your question. Sonia, did you still have a question for Yvonne? Oh, there you are.
There you are.
Guys, I pressed the hand by mistake.
Oh,
isn't
no
that
problem.
how it always happens?
Yes, I'm sorry.
No problem.
Okay.
All right, we'll move on to Dawn. Dawn, if you'd like to come off mute and ask your question.
Yes, thank you for taking my question. Um, I'm a retired school employee,
Uh-huh.
and I know, and I was involved in the financial business for a while also, and I know that CalPERS is quite active in sustainability,
Uh-huh.
which is kind of the relabel for ESG these days. Um, and to a large degree, I disagree with the ESG approach that it is. I don't believe that climate change has as much influence on companies as CalPERS believes it does. And I don't know exactly what other categories of industries are on the naughty list with CalPERS. I would guess something like firearms, tobacco, fossil fuels. And I am most interested in the returns that CalPERS earns on its portfolio that then secure my and others' retirements than I am about social engineering by CalPERS. So I would like if you would take that message back to the others on the board on my behalf.
I certainly will, Don. And I just want to remind everybody on the call too. We talk about ESG or climate action and everything else. And honestly, those are filters that we use. They are not deciders; they are filters. And I think it would be irresponsible of us not to consider everything. But that doesn't necessarily mean that is the only decision we make. It's just another source of information.
Thanks, Dawn. All right, now moving on to Dana. Dana, if you want to come off mute and ask your question,
Yes, I think I'm off mute now.
you
You
are.
are.
Thank you. My question is, I'm a retiree that is outside of the state. Do
Uh-huh.
I ever worry that I will not be able to get health insurance through CalPERS?
No.
Because there was only one option this time.
There
It was
is only one option, and we continue to try to figure it out. I will say, one of the reasons why there's only one option is because we don't have the same purchasing power outside of California as we do inside, right? We don't have
okay.
a critical mass. So it will probably always be the PPO, but we still continue to try to lower the costs, even though, that's what it is. Does that make
Okay.
sense?
It did. It's just it went up so significantly this last year,
I
and
know. That
there
was horrible.
it was crazy. So I'm kind of anxious about my choices in the future.
Ah, well, you'll be happy this year.
Okay. And very good. But I won't need to worry that there won't be an option. It's just we don't know if we can control the cost, is what you're saying.
Right, right. And I can't tell you what the option will be because again, we're always looking to, improve. But odds are it will be a PPO.
Right.
But I think the only way around that is for what is it? Universal health care. But we're
Yeah.
not there yet as a nation. So
Right.
we just do it. And then the funny thing is my daughter, she works for an insurance company based in Texas. And she's here in California. And she has to pay out of state rates, which are significant. So I do think that this is something that collectively we need to figure out.
Thank you.
Mhm.
Kathy, it looks like you're next on the list. If you'd like to come off mute and ask your question.
So the previous question was actually part of my question. Can you hear me okay?
Yeah, Kathy, I can.
Yeah, just looking at other alternatives like the gold plan on PPO, anything that could help. Because I know we do have Blue Cross and Blue Shield here in Idaho where I am. So yeah, anything would be helpful there. The
Right.
other thing is, as an out-of-state employee, I know my employer is able to do out-of-state taxes and filing the taxes. I don't understand why CalPERS is not able to collect and remit taxes for out-of-state. Why, we have to pay directly, and it's kind of a pain. It'd be much more convenient and easier to have it withheld from the paycheck.
Oh, you mean the payroll deduction?
Yeah. I mean, my small little water agency is able to remit out-of-state taxes. I don't understand why CalPERS is not able to
Huh, I did
withhold it. Yeah.
to withhold that amount. I don't know. I can check. That's the first time I've heard that, but I can check it out.
Yeah, that would be awesome. Thank you.
Okay.
All right, let's see who's next on the list. Laura, if you want to come off mute and ask your question.
Yvonne, thank you so much for your accessibility here. I want to flag what is, I think, an across-the-board public policy issue that's affecting many of us. And my question is going to relate to how I can connect either to you or someone else at the highest level of CalPERS about the policy concern, because my current situation is fine. So the issue is this, that many of the major providers, provider systems, Sutter, I've now found out that it's the case currently with UC Davis, do not at any given time take new Medicare primary care patients. We have what is Cadillac insurance that you are paying for, and indirectly we're paying for it because even though my health insurance is free, the price of it cuts into what you pay for my Medicare Part B. I discovered this a year ago when I was looking for a new primary care physician and had a Sutter primary care physician, that even though I was in their system, they were not taking any new Medicare primary care patients even to change. I currently have an excellent primary care physician, but in trying to help a friend get situated with my own primary care physician at UCD, my friend, who is a retiree, retired medical professional, actually has the same kind of excellent insurance that we do through UCD, was told that, again, they were not taking any new Medicare primary care patients. So this goes to the issue of equity that you raised, the policy in PEMCA that as retiree medical beneficiaries, we have comparable insurance. I have, as someone who worked on CalPERS health plan contracts and for another state agency, I have thoughts that are, more complex than we can get into here about some ways that CalPERS can use its leverage, both contractual, indirectly, and the bully pulpit. But I know that if I contacted customer service or wrote in, I would get some very helpful person reaching out and saying, how can I help you use your benefits? Right now, I am well situated, but I've worked for decades in the health public policy area. I care about this. I do have thoughts about how CalPERS can be a force on this and not have like your jillions of super well insured, expensively insured beneficiaries not have equal access to healthcare. And so what I want to know is, how can I follow up with someone at the appropriate level who's in CalPERS' strategic thinking, because I don't need personal help right now after a long time, looking for someone. It's hey, this is a real public policy problem. So how can I connect with the right person about this?
So you can send it to me. I'll pass it along. I'll tell you how.
Thank you.
And I'll pass it along to the appropriate place.
Perfect.
We also have stakeholder forums that you can sign up for. If you call into the contact center to find out how to sign up for the stakeholder forums to be on there, but send it to me. That's yvonne.walker@calpers.ca.gov.
Okay, that's great, because this is not, I worked at CalPERS. I was for many years the lead person in the legal office on CalPERS' health issues. I know from experience that this is not a staffer issue. This is someone high up has to care about this and then feed it back down. But I do have thoughts that might be useful. So I will start with you, and thank you very much for your concern about this.
Yeah, and do me a favor, Laura, and reference this webinar.
I will. And my
because
last
I don't check my email daily. I will tell you.
I will
So,
reference it. I'll put something appropriate in the subject line. My last name
okay,
is Rosenthal. I didn't want to put it on the thing, but I
I
mean, I
appreciate
had
that.
years of experience at CalPERS and then as chief counsel for another state agency that did major health contracting. So at this point, I just want to, kind of
You want
help
to
with the
share your
voice on
knowledge?
that. Yeah. Thank you very much.
Absolutely.
Thank you. I believe it's Ronnie, if you want to come off mute.
Can you hear me?
Yes.
Yes, ma'am.
Okay. So I've had the experience of having a long-term physical therapist
Mm-hmm.
who has never agreed to be a in-network provider because every time the insurance plans offer him a compensation, it's never covering never covering his costs. Before they weren't even paying his Medicare, a Medicare rate, which is a pretty I guess fair. He seems to think that the Medicare rate that's being paid to him is fair for what he bills. So when I get a statement from Medicare, often the the PPO, the plan that I'm using, I think I'm in the one that a lot of the out of staters have to use too, because my son goes out of state for medical. Um, he's a disabled dependent, and they will they will not pay him. They will send a for their portion, which is often just a small, like $22. They'll send the check to me. They'll say that he's not,
He's out of network.
he's out of network, and they create this sludge in the system. It would, and before they were, sometimes they were paying him directly, and sometimes they would just send it to me, and it's just like all over the place. So it just, when Medicare is the primary and they're the responsible second, they don't have a choice. It's a PPO. They should just pay the provider, whoever it is. That's the nature of a PPO. They should not be doing this. Oh, you're not in our network. We don't have to pay you. We'll just pay the patient. Um, and it's like sending paper checks these days. Really? I mean, come on. This just creates this sludge in the system. So they hope that I won't cash the check. They'll get to keep the money and pocket it. Um, this is what these kinds of practices do. They create sludge in the system and they make it more difficult for everybody to operate smoothly. It's like he has to employ so many people just to deal with insurance.
Mm-hmm.
Um, it's like he has three people working with insurance, and he only has like two aides and two PTs, two therapists in the office at any one time. But three people are like running in and out of there, um, dealing with insurance.
I know. That's frustrating.
It's a small business. I want the
Right.
guy to survive and succeed, and he's like the one of the best in town. He works with a lot of the athletes. The basketball players are in there sometimes. The golf pros. This is the kind of person I want to work with. Somebody who's just like the top of the line.
Right.
So I don't know if there's anything that you can say. I have called. Um, I know the helpline or whatever regular um, service. I have called them, um, and I just get this this song and dance.
Right. Well, let me see if I can get you not a song and dance. I don't know if it'll be helpful, but at
Okay.
least it won't be a song and dance. And I know exactly what you're talking about. I just got a check for $3, and all I could think was it cost you more to print it and send it to me than to just
Absolutely. This
do
is
it electronically. That's crazy to me, but
yeah, yeah. And they're just hoping you never cash it, and they get to keep the $3.
they probably will because I can't remember where I put the check. So, all
Okay. Thank you. Appreciate
right,
it.
Annie. Okay.
You're doing a great job. Thanks.
Thank you.
Teresa, if you want to come off mute and ask your question.
Hi, yes, good morning. So I was the one that brought up the Kaiser coming to Nevada at one
Oh,
of the
yeah.
previous meetings, and I appreciate you looking into that. I do have a few questions though. So I know they're working with Renown Medical Center, and they did just open up a clinic
Mhm.
in my area. And my question is, it looks like since it's a partnership, we would go to Renown for different tests and things like that. So Kaiser's gonna cover, my question is, Kaiser's gonna cover
Yes.
whatever test?
Yes.
Okay, good.
Yeah. Because that is their like interim step. They're looking to get there solidly, but
Yeah,
until they do, right, they've made it an extra step, which I think is fine. The coverage is what's important.
exactly. Because being on the one coverage has been costly and inconvenient
Right.
and frustrating. So because
Right.
like if the doctor orders a Dexcom G7, it'll be covered, I'm assuming, because with the other insurance it wasn't. So
Mm.
is it safe to
Kaiser's normally
assume?
really good with that stuff. So I mean,
Yeah,
I can't
exactly.
speak for Kaiser, but everything I know says they're really good about that stuff. So
Okay,
I
yeah,
wouldn't
because we've had
anticipate a
Kaiser.
problem.
Yeah, we had Kaiser before. So my question is, if I go into the CalPERS website and I look at what the Kaiser coverage is, will it be the same for next year for Nevada?
Um, it I don't know. It should be, I want to say, but I don't know. So go look. Okay.
Okay.
And if
At least
there's
I'm
a
doing it. Yeah.
problem, contact me back.
Okay.
Yeah.
And then you said by zip code, which I'm in the same area, the same city, so
Right.
that won't be a problem. Medicare, just a quick question. I still have a few years before I have to do that, but does
Okay.
Kaiser part of Medicare coverage?
They have a Kaiser Advantage. I don't know what they call it, but they have an Advantage plan with Kaiser. So if you're in Kaiser and you're there for, your regular stuff, right? And then
Yeah.
you retire, go on uh, Medicare, you go in their Advantage plan. It's a seamless transition.
Okay, good.
Yeah, it
Okay.
was seamless for me when I went into, I was with Sutter, UHC. And so when I went to their Advantage plan, once I went to Medicare, it was seamless.
Okay,
I was
cool.
worried about it because I was getting treatment and, but turned out not to be a problem at all.
Oh, wonderful. Okay, I'm trying to check because I have notes here. I
Okay.
think I've covered everything. Um, yeah,
Then
I
you
think
brought
so.
something to mind for me. Also, starting in, they're looking at Kaiser, not Kaiser, CalPERS is looking at establishing clinics, right? And I think for our folks that are outside like major urban areas, and to provide better access to care. And so there will be more details coming, but it looks like the first one goes up in 2027. So I will be looking for that and continue to report on that for you. But I'm very excited about this because, again, it's about trying to provide access to care any kind of way that we can.
Yeah, which I appreciate the whole Kaiser thing because it's been a rough couple years getting
Right.
used to the new coverage and what they don't cover and the hoops that you have to go through is like crazy. So
Oh,
I
yeah.
appreciate that. Thank you.
Okay.
Rick, if you want to come off mute and ask your question.
Okay, thank you. Mostly it's a comment, and the earlier gentleman put it pretty well. It sounds like from your numbers that CalPERS is investing for return. And for those of us that are a ways out of the system, also out of state, that's very important. And I remember a time when CalPERS decided to divest themselves of any fossil fuel products, and they did it kind of recklessly, sold at the bottom of the market. It wasn't a gradual divestment. And so, yeah, I understand everybody's got their concerns about the environment and all the other things, but for those of us that depend on CalPERS as a lifeline, investing for return is just so very critical for us. And
that's our number one priority.
Yeah, and I'm glad it is. And like I say, I remember a time where it wasn't, and I'm glad to hear that it's back.
Good. Thank you, Rick.
Mason, if you want to come off mute and ask your question.
Hi, can you hear me?
Yes, ma'am. Could you speak up just a little bit because your voice is soft for me?
Okay, so lucky, funny that my question is a follow-up also to the first question that Ron put at the beginning. And I just want to say that I'm very grateful for CalPERS because both me and my husband are retired and living very well and have excellent health care because of the hard work that CalPERS and the smart ways they invest. However, I feel guilty that if my well-being is going to be based on the shoulders of some investments that could harm others. So I would really like to get to know more about how does CalPERS invest our money. And I know there is I probably can do some research on my own. And I know CalPERS does publish some, reports on how do they invest, general reports. But is there, if I start digging deep into it, would I be able to find out exactly what companies that CalPERS is investing its money in?
Huh.
Yeah, by name.
The exact companies. I don't know because, the reason why I say I don't know is because sometimes they invest in a fund that has a lot of companies underneath it.
Okay.
Right. And so you could probably find out the fund, but I don't know if we'd know like all the I don't know what all is provided. Let me find out. I don't know what all is provided, and I don't want to give out wrong information. But as you're doing your research, I invite you to we have a lot of webinars up on the website with a lot of good information. And that's always a good place to start.
Okay.
And as you think through more questions.
Okay. And can I reach out to somebody? Who would I reach out to for further information once I finish my own research?
If you do board services, what is it, Simone? Board serve? Could you help me out?
Yeah, let me look up the email really quick. Hold on a second.
Okay. We're going to can we just type it in for him?
Yeah, if you can put it in the question and answer thing, I can copy it. I can copy it and get the information.
Yeah,
thank you.
If I said it off the top of my head, it would be the wrong one.
Okay. Thank you very much.
Okay.
All right, Jay, you're up next.
Hi there.
Hi, Jay.
Thank you for your efforts in reaching out. I did send a one-page document to CalPERS Stakeholder Relations on the 11th, and the title was System Problem for Retirees Who Are Also Retired Military. I don't know if you were able to see that. I don't want to waste a lot of time. It is a short one-page thing, but it's a system problem that creates a significant problem for military retirees by automatically being enrolled in Medicare Part D, even though we don't need it because we have TRICARE for life, and my wife and I get our medications through Express Scripts, and every 4 years, I'm over 80, and before my wife and I first enrolled in Medicare Parts A and B, and then several years back, CalPERS and we always got the platinum level supplemental plan to Medicare. And several years back, CalPERS automatically began enrolling everybody in those supplemental plans in Medicare Part D. Then when that happens every 4 years, when the prescription provider is changed under the and it comes time for periodic enrollment, Medicare or Social Security starts charging us for Medicare Part D, and we don't use it, and it disrupts our medication. The military does not then become our main provider for
Your primary
medications,
provider.
and it disrupts our sequence for receiving medications in a timely fashion. And I thank you for your service.
Oh, you too, retired Army.
Yes, ma'am.
So let me find out. I did see the question. Remember when I said at the beginning that some of them were complex, too complex for me to do on the call? I did see the question. We are going to get back to you. Right?
Okay. I certainly appreciate
on
that.
what that is. And thank you for sending it in.
Okay. Thank you, ma'am. And you have a wonderful day.
You also.
William, if you want to come off mute and ask your question.
Oh, we got Cynthia, otherwise known as William.
I think that dropped. So Cynthia, if you want to come off mute and ask your question. There you go. It looks like you're off mute, but we can't hear you.
Can you hear me now?
We can hear you now.
Oh, good. Okay. I am about to enroll in Medicare. And I got a long letter from CalPERS that says important information regarding health coverage at 65. It's a little bit confusing, but it listed CalPERS offers the following Medicare health benefit plans. And I noticed that, what is it? Well, Sharp is out of my area. I'm in Southern California.
Okay.
Let's see. And Kaiser looks like the only HMOs.
I don't remember off the top of my head.
Okay. The rest seem to be PPOs. Anthem Blue Cross, Blue Shield, PERS Gold or PERS Platinum. Yeah, they're all, even United Healthcare, they're all PPOs. I wanted to look at the costs before I could make a decision, and there isn't such a thing in this letter. So where can I find that information?
So we just approved the new rates this last Wednesday, or it might have been Tuesday. But so it's going to go up on the website, what the new rates are. If it's not up already, it will be up, I anticipate, within the week.
Oh, okay, great.
Yeah, because with open enrollment coming, we want to make sure that people have enough time to make a good decision.
Right, right. And
Are you hearing an echo? Okay,
no,
I'm hearing an echo. I got feedback, but go ahead.
Sorry. Yeah, I have to enroll next month.
Okay.
So that's going to be before open enrollment.
And you're in Sharp now?
No, I'm with Blue Shield right now.
Okay. And they too have an advantage plan, I believe.
Well, it says here Blue Shield Medicare Advantage, but it's a PPO. So I wanted to know what the cost would be because I've always been an HMO.
Oh, I see what you're saying. So I don't know, and that is up on the website. You can look up the if it's not there, it should be there. But at any rate, but I will just tell you from personal experience, when I went from the United Healthcare Basic to the United Healthcare Advantage, there was no cost at all, and actually my prescriptions went down.
Oh,
I know. I was surprised. I was like, ooh, woohoo.
That's good news.
Right. Because they cover more, with the Medicare. And then, so they went down.
Now, my girlfriend who's already on on Medicare. She's a state employee, former state employee. I was asking her some questions to help me, with this decision. And she said that they chose a health plan, but they got an advantage plan for extra coverage.
Right.
I'm not sure I understand that.
Okay. So for the advantage plans, right? When they're trying to get people over, they, like I have free gym membership, and they, when I do all of my tests, I get a card they reload the card for like up to $35, $50 or whatever. So to make sure you're going through all your primary care stuff. So they do some extra things, and that's just to entice you over. And the gym thing was nice, but I will tell you, my primary decision maker was, where are my doctors? Because I don't want to change my doctors.
Right.
So that was my primary,
Okay.
and wherever that fit in, that's where I was.
Yeah, that sounds good. I like my doctors right now too. So,
Right.
okay.
So,
Thank you.
sure.
All right, Christopher, it looks like you're next if you want to come off mute and ask your question. Christopher, did you still have a question? Should be able to click the little microphone icon next to your hand. Okay, maybe we'll go to Dana and then back to Christopher.
Okay.
So Dana, did you have a question?
Yes, I do. I should have asked about my husband who's going to be signing up for Medicare when he turns 65. I assume now he's a dependent on mine. I just want to make sure he does have still access. And again, we're out of state, so that shouldn't be an issue, I'm hoping. Is that correct?
You will be in what they call a hybrid plan.
Okay.
Since you're the primary account holder.
Yes.
It won't be a problem for him getting coverage and everything else, but he won't be like, if he's there, he won't be able to go on an advantage plan while you're in, say you're in the PPO and he wanted to do, United Healthcare Advantage. He couldn't. He'd have to stay with where you are.
Okay.
Does
So
that make sense?
I'm still learning about this. So he would
I know.
do his Medicare,
Right.
but he could not get Medicare Advantage. Is that what you're saying?
Yeah, as long as you're not retired yet, because you're the primary holder. Isn't that right, Simone? Am I thinking this wrong?
So you have one that's Medicare eligible and you have one that isn't Medicare eligible age. So you have to
Right.
pick a plan where the plan offers both a basic and a Medicare option.
Okay.
Okay, I think I'm understanding. I'm concerned about costs. If we don't have Medicare Advantage, that means that we can't cap our costs, if I'm understanding right. So I guess we just have to see.
Yeah. Yeah. Then see, and like, where is he enrolling before open enrollment?
No,
Okay.
he's going to turn 65 in December.
Oh, good. So then pay very close attention to the open enrollment thing. And that's a time where you can send in questions and stuff.
Oh, okay. So that's when I would ask the questions.
Yeah.
And then at that point, I would even know what option I have for myself because we're
Right.
not sure yet.
Yeah.
Okay, so I have to wait till then. All right. Open enrollment is in October,
September, isn't it?
September. Okay.
Yes, it starts
Is it
in
September,
September.
Simone?
Mhm. Yes.
Oh, good.
And
Got that one right.
we get notified of that?
Oh,
And-
absolutely. It'll
Okay.
be all over the place. And we'll have webinars too
Okay,
that
thank
you
you
can
very
get
much.
on.
Okay, thank you.
Okay.
Yes, it's the September 14th through October 9th.
Okay. You heard that. September 14th through October 9th.
All right, let's see who's next on our list. Patrick, you're next if you want to come off mute and ask your question.
Hi, this is Patrick. How are you?
Hi, Patrick.
So I have a question, and I live out of state, and I'm on Medicare, and my wife is currently not. However, I have a concern that the state of California is going to institute the largest tax increase in taxing medical premiums in the state. And I'm wondering is number one, are we going to be exempt since we no longer live in the state? But from the articles I read, they're going to bury the tax under the fees category. So nobody will really be aware of the simple fact that they're paying the tax, which is going to come out to about $108 per individual. Are you guys aware of this, or are you guys working on this, or how's that going to work with CalPERS?
I can't tell you how it's going to work. I can tell you, yes, we are aware. And as we get more final information, I'll be able to share that. But yes, we are aware.
Okay. Well, I appreciate it. I have one other question.
Okay.
I know you addressed this several town halls ago about when you send emails, it's supposed to go to a clearing center, which basically responds to your emails. But I sent a number of emails throughout the last couple of years, and I've never once received a response back from CalPERS. And I specifically, no, I never once have. And you know, and I know you addressed it, and I do email you directly, and I'm sure it's going to somebody who's supposed to respond to it, but for some reason they just go unanswered.
Well, okay, if you're emailing me directly, and I just have to tell everybody this, email is the worst way to contact me because I don't check my email regularly. But if you send me an email, right, send me a text telling me you sent it. And then, you know, I'll go look for it. But otherwise it might be, you know, it could be a week or it could be a month before I go back in and check.
Oh, okay. So we should be sending it to where if we have a question?
You can send it to the I think it's a board services unit, right?
Okay.
Yvonne, I got the email. It's board.
Okay.
So board@calpers.ca.gov.
Okay. Well, hey, I appreciate it, and thank you for doing these town halls. I really appreciate it. Thank you.
Yeah, and if you know if you're sending stuff and you're not getting a response, send me a text, and then I can just follow up and see what's happening.
Okay. Well, thank you very much.
Okay.
Right. I believe it's Alfreda. If you want to come off mute and ask your question.
Yes. Can you hear me?
Yes, ma'am.
Okay. My question is, I have my son who is turning 26 in next April. And so this will be the first time he won't be on my health insurance. So I got a letter from CalPERS, and all it basically tells me is that they'll be basically deleting him. So
yeah.
I wanted to find out, is there a smooth process, or do I need to contact, right now we've always had Kaiser myself, and try to find a plan that's close to what he's had his entire life pretty much, or does CalPERS help us find a plan, or do I just need to go to Cover California?
You need to go to Cover California.
Okay. That's
yeah, because we're gonna drop him.
Yeah.
that sounds harsh. It's not. Yeah. And is he working?
Yeah. See, I wanted to compare the plan that he might have from work to see which would be better for him. And so
that's where you should start to see what his plan is.
Okay.
You know, and then because that's, you know, it's on him now, unfortunately.
Yes.
But I'm glad you're helping.
Yeah, I'm helping because I'm like, okay. And I know our open enrollment is in October. His birthday is in
No,
April.
September.
I mean,
We should
in
just said September 14th through,
October 9th.
yeah.
Okay, so do he'll be enrolled in the September for a certain period of time, or for January till his birthday, or how does that work? Like if I get,
Okay, that I don't know.
okay, that's so I may need to contact CalPERS and find out about
And
that
just ask
period
that,
of
like, I
time.
mean, when do they drop them off? Do they, yeah,
I
that
think
I
it's
don't
the
know.
first month of the
Of
first.
his birthday?
Yeah, yeah, I
Yeah.
think that's what happens. But I want to,
You should have a plan in place before that.
right, that's what I'm saying. So I don't want, that's what I was wondering if how early we can start. Like if he gets a plan, will he be able to use CalPERS up until like April 1st, and then or the month
And then switch
before?
over?
Yeah,
Yeah,
yeah.
probably, but I
Okay.
don't know.
Well, thank you. I will definitely go to Cover Cal and we'll look at what they offer at work. We just never
Right,
did.
right. And yeah, at least you have time to make decisions, and that's wonderful.
Yes. Well, thank you so much, and we appreciate the hard work you're doing.
Oh, I appreciate all of you getting on because I will tell you all, you really, really motivate me. And I just appreciate the fact that you're interested in getting on. And like I said from the very beginning, as long as you're getting on, we're going to be having these calls.
Right on. Well, thank you, and y'all have a good day.
Okay, you too. So we're coming up on the end of the hour. I want to do one final thing, my constant reminder that to make sure you have your power of attorney signed up with CalPERS. And then also, and I tell people this all the time, you should check, even if you've already signed up your power of attorney, your beneficiary, you should check at least, every couple of years just to make sure everything is where you want it to be. Because sometimes things change, right? You might have a kid that was going to be your person, and then, they took a different road in life, and, you didn't think about changing it, or, you might have gotten divorced and forgot to go and change the paperwork, and then damn it, now your ex is going to get your stuff. So anyway, go and check. Go and check. And everybody have a wonderful summer. And we will talk to you. This is September. We will talk to you in September. Thank you guys for getting on. I really appreciate you. Bye.